President Dr. Gregory Postel, who just gave us a great tour of the vaccine site. Mr. President, thank you for our visit.
Thank you, Governor. Good afternoon. On behalf of the students, faculty, and staff of the University of Toledo, it is my sincere pleasure today to welcome Governor Mike DeWine to our campus. It's also an opportunity for me to thank the governor. During my 9 months at the University of Toledo, brief but busy, I've had many opportunities to see how the governor's assistants have benefited the members of this campus community. The governor is a staunch advocate for higher education, and his support has enabled campuses throughout the state of Ohio to receive COVID stimulus funds, which for us in this past year have been essential in order to make ends meet. He has also been a visionary leader for the state of Ohio throughout the entire coronavirus pandemic, on many cases coming to our assistance to supply first much-needed testing materials and now vaccines. There is clearly evidence that success is occurring as it pertains to the coronavirus pandemic. However, as we'll hear today, much work still needs to be done. Most Americans have still not been vaccinated. Coronavirus cases and hospitalizations are on the rise in many states, and including in Lucas County. Unfortunately, our neighbors to the north in Michigan are experiencing these problems as well. Younger patients are appearing in our emergency rooms in larger numbers with varying severity of their symptoms. Variants of the virus have been well publicized and are a great source of concern. So based upon this, the University of Toledo continues to stay very focused in our efforts to vaccinate as many of our students, faculty, and staff as possible. And in the recent month, we have accelerated our efforts with multiple functions such as the one today, where students had an opportunity to receive a vaccine. Originally, we were planning on administering the Johnson & Johnson vaccine, but yesterday we pivoted to a dual dose vaccination regimen. And fortunately, there's still time for our students to receive their second dose before the graduation ceremonies. The University of Toledo Medical Center, the university's main hospital, has been a tremendous resource to us throughout this crisis. And also the Lucas County Health Department has been a terrific partner as we've worked through the coronavirus pandemic. I cannot say how grateful we are to the volunteers, the students, the staff, and the faculty at the University of Toledo Medical Center, because without them, these efforts would not be possible. So far, nearly 25,000 doses of vaccine have been administered, which is yet another great example of how critical this hospital is to the Toledo community. Again, my thanks to the governor and a very warm welcome to our campus today.
Well, Mr. President, thank you very much. Fran and I have really enjoyed our visit. We appreciate it very, very much. Fran and I had a great tour. We saw where they're vaccinating students today, had the opportunity to talk to some of the students. At the same time, we talked to medical students who are working there, as well as pharmacy students and nursing students. So it was great to see all three disciplines and all represented there doing some really great work. We appreciated that very much. Fran, I think have been to about 34 vaccination sites, and I was kidding the president. I said, this is the only one I think that we visited that had a T-shirt. Once you got your shot, you got a T-shirt. So I'll hold this up. This is, and we got a little bit on the back there too. So anyway, every rocket has a mission to improve the human condition. So, Mr. President, I like that a lot.
I'm very glad.
Thank you. Very, very good. We also have today a student leader, Anjali Phadke, who is joining us today. She's a student at UT, and thank you very much for joining us. How was it today? Did you get a shot?
I actually have been fortunate enough to receive the Pfizer vaccine a couple weeks ago.
A couple weeks ago.
Yes, I'm fully vaccinated now.
That is good. So
Yeah.
that is good. What are you seeing hesitancy among students? What do most students feel?
At the moment, I think that as a community, we've been really lucky to have students that are so willing to receive the vaccine and protect their community and those around them. As a college student, it's imperative that we protect our community, as we are not likely to pass away from this virus. We need to protect others, and my fellow classmates, fellow student leaders have been amazing and wonderful and have received both doses. So it's been really great to see everyone's so willing to get the vaccine. I think the only hesitancy at the moment might be, what the side effects may be, but as a community, we've been doing a great job.
Well, Fran, I've talked to a lot of students and others who have gotten their vaccine, and one of the things that we find is that what really influences people is their family members as well as their friends.
Right.
And so, what you and others are doing on the campus at UT is very important. So thank you.
Thank you so much.
Keep that up, and we appreciate you being with us here. What's your major?
I'm a bioengineering major. I'm a pre-med concentration with minors in chemistry and psychology.
It's great. Good luck.
Thank you so much.
Thanks for joining us. We really appreciate it.
Thank you.
We had also the occasion, as Fran and I were walking around talking to people, to meet Dr. Susan Batten, who is an associate professor in the College of Nursing here at UT. She's been working with a number of clinics, and she was telling us what she was doing. And frankly, I was intrigued by some of the work that she and her team have been doing. Doctor, tell us a little bit about some of how you're trying to really take the vaccine out to the community and reach people who might not have been reached any other way.
Through UT student organization and its community care clinic, which is a free clinic for the public, we've been going to schools. We go to Escuela Smart School on the south side of town. It's predominantly Hispanic. It's in the evening. It's convenient. We have a African-American church over near the museum. Tabernacle, we go there on Tuesday evenings. Monday evenings, we're on the street, and that's probably the one that I get the most fun. We have a free clinic on the street. We've been doing this for about 10 years.
On the street?
On the street, sir, in a parking lot. And with one big parking lot light, we take some lighting with us. And we have people in the community that are homeless and multi-home, different situations come and get their vaccine from us, and they're so happy. And I'm real happy because we had a 90% return rate. We did Moderna. We did the second dose this past Monday at 90%. I thought that was braggable.
People came back.
People came back. So we're doing vaccine on the street. And then on Thursday at Community Care Clinic, which is an ongoing community care free clinic site, we've been doing vaccine there for about 6 weeks now. So it's student driven. Some of the faculty are fortunate to be kind of the guides, but the supports for the students. So we're there. We can't do it alone. We have an army. We've worked with Lucas County. We've worked with Wood County, getting out because this is something we all share. And a lot of students share the thought, the obligation, we can do something about this. They're not ready to be in the lab yet. They're not ready for practice. They're still in school, but they know they can make a difference, and they can legally give with supervision vaccine, and they love it.
Well, that is just great. After you told me that, I wanted you really to share that with everybody in the state, because I know other communities are doing things like that, but this is one of the neatest things I've heard. And, it's what we have to do if we're going to reach people, and we have to reach them where they are. And that's what you're doing. So thank you, and thank all the students who are working with you. And it's just a great thing.
I think we've done probably close to 40,000 immunizations totally.
Really?
That's a lot of work, and I'm indebted to the students. They're wonderful. Thank you for having me.
Thank them too.
Okay.